So part of my responsibility as a Chief Medical Officer of Health is to inform Ontarians, and I think the first step is educating. It's not just COVID-19 anymore. We are dealing with the complexity of COVID-19, influenza, and RSV. And I'm very concerned that children are being admitted to our hospitals and are in our intensive care units, principally 4 and under, that cannot mask. So everyone around them, the parent, the sibling, the grandparent, I'm urging them to protect the most vulnerable of us, our children, by adhering to all the layers of protection. What might be a cold to you can lead to a severe respiratory infection in a child 4 and under. So there is a complexity now that it's important that all Ontarians understand, and we have to get back to the basics. If you have children and you yourself has a cold, that can be a serious and significant respiratory illness in a 2-year-old or 3-year-old. So as we go indoors, my principal message today is to protect our children, follow all the layers of protection. Our hospital system needs us to protect our children more and more. And it's not just masking, it's the layers of protection. If you have any symptoms of infection, you should mask around those that are the most vulnerable to our individuals. You should be screening on a daily basis. Good hand hygiene is going to be exceptionally important with RSV and influenza. It's a call to vaccinate against influenza and COVID, as there's no vaccine against RSV. We need to protect our health system. We need to protect each other, and it's really getting back to all of those basics. We need a reboot, a reminder of what will keep us safe for the rest of the winter season, and today's the key message of getting back to the basics of protecting our most vulnerable. This is different than COVID. This is protecting our children, and those are the youngest above us. Please, parents, grandparents, siblings, if you have any respiratory symptoms, you must mask around those that are vulnerable. Masking in mandatory masking in a certain venue may help decrease the risk at a community level, but I'm very concerned about our children and protecting our children right now, and it's best that we protect them through masking in the home environment and in any social situation as we go into what will be a very social environment in winter.